Pharmacology, gastrointestinal system, anti-ulcer medications. The stomach contains cells that secrete different substances as part of the digestive process: parietal cells, chief cells, and surface epithelial cells. Surface epithelium cells are found within the lining of the stomach and secrete mucus as a protective coating. Parietal cells and chief cells are found within the gastric glands. Parietal cells produce and secrete hydrochloric acid, or HCl, to maintain the acidity of the environment of a pH of between 1 to 4. Parietal cells also secrete a substance called intrinsic factor, which is necessary for the absorption of vitamin B12 and the small intestine. Parietal cells are the primary site of action for many drugs that treat acid-related disorders. Chief cells secrete pepsinogen that becomes pepsin, a digestive enzyme, when exposed to acid. The stomach also contains enteroendocrine cells, or ECL, or enterochromaffin-like cells located in the gastric glands that secrete substances including serotonin, histamine, and somatostatin. G cells in the stomach secrete gastrin that promotes secretions of digestive substances. Although these cells play an important role in the digestive system, acid-related diseases can occur when there is an imbalance of secretions. The most common mild to moderate hyperacid condition is gastroesophageal reflux disease, or GERD, often referred to by patients as heartburn, indigestion, or sour stomach. GERD is caused by excessive hydrochloric acid that tends to back up or reflux into the lower esophagus. Peptic ulcer disease, or PUD, occurs when gastric or duodenal ulcers are caused by the breakdown of GI mucosa by pepsin, in combination with the caustic effects of hydrochloric acid. Peptic ulcer disease is the most harmful disease related to hyperacidity because it can result in bleeding ulcers, a life-threatening condition. Stress-related mucosal damage is another common condition that can occur in hospitalized patients, leading to peptic ulcer disease. Thus, many post-operative or critically ill patients receive medication to prevent the formation of a stress ulcer, which is also called prophylaxis. Whenever hyperacidity medications are administered, there are common assessments that should be documented, such as an abdominal assessment and documentation of bowel patterns. During therapy, the nurse should continue to assess for potential medication interactions and side effects, and be aware that vitamin B12 malabsorption may occur whenever stomach acidity levels are altered. Based on the category of medication, renal and liver function may require monitoring. Additionally, if a patient complains of chest pain, the nurse should perform a complete focused cardiac assessment and not assume it is GI related, because patients may erroneously attribute many cardiac conditions to heartburn. Implementation: the nurse should read the drug label information and follow the recommendations for administering hyperacidity medications with other medications or the intake of food. Cultural preferences should also be accommodated when safe and feasible, because the patient may believe in alternative methods for treating GI discomfort. A written plan of care with modifications for safe use of medications with these alternative methods may be required. Evaluation. Patients should experience improvement of symptoms within the defined time period. If not, the provider should be notified. Increased pain or new symptoms of coughing, vomiting of blood should be immediately reported because these symptoms can be signs of a life-threatening bleeding ulcer. Hyperacidity medication classes. There are 4 major classes of medications used to treat hyperacidity conditions: antacids, H2 receptor antagonists, proton pump inhibitors, and mucosal protectants. Each class of medication is further described below. Antacids. Antacids are used to neutralize stomach acid and reduce the symptoms of heartburn. There are many over-the-counter medications available for this purpose, such as calcium carbonate, aluminum hydroxide, and magnesium hydroxide. Calcium carbonate is the prototype discussed as an example. Be sure to read drug label information regarding antacids as you administer them because each type has its own specific side effects. Many antacids also contain simethicone, an anti-flatulent used for gas relief. Simethicone is further described in the medication grid. So antacids are used to relieve heartburn, acid indigestion, and upset stomach. The mechanism of action. Antacids neutralize gastric acidity and elevate the pH of the stomach. Elevated pH also inactivates pepsin, a digestive enzyme. Specific administration considerations. Calcium carbonate comes in various formations such as a tablet, a chewable tablet, a capsule, or liquid to take by mouth. It is usually taken 3 or 4 times a day. Chewable tablets should be chewed thoroughly before being swallowed. Do not swallow them whole. The patient should drink a full glass of water after taking either the regular or chewable tablets or capsules. Some liquid forms of calcium carbonate must be shaken well before use. Do not administer calcium carbonate within 1 to 2 hours of other medicines because calcium may decrease the effectiveness of the other medicine. Calcium carbonate may be contraindicated in patients with pre-existing kidney disease because it may cause hypercalcemia. Common side effects of calcium carbonate include constipation and rebound hyperacidity when it is discontinued. Patients should be reminded to take over-the-counter medications appropriately as prescribed and to not exceed the maximum dose. Other interventions to prevent hyperacidity can also be recommended, such as smoking cessation and avoiding food and beverages that can cause increased acidity, such as alcohol, high-fat or spicy foods, and caffeine. So H2 receptor antagonists. A common H2 receptor antagonist is Famotidine. It is available over the counter and is also often prescribed orally or as an IV injection in the hospital setting. Other H2 receptor antagonists include Famotidine and Ranitidine. Famotidine has a high risk of drug interactions, especially in elderly patients, because of its binding to cytochrome P450 enzymes in the liver, which affects the metabolism of other drugs. Famotidine. Famotidine is used to treat gastroesophageal reflux disease, peptic ulcer disease, erosive esophagitis, and hypersecretory conditions, or as adjunct treatment for the control of upper GI bleeding. Over-the-counter famotidine is also used to treat heartburn or sour stomach. The mechanism of action. H2 receptor antagonists block histamine's action at the H2 receptor of the parietal cell, thus reducing the production of hydrochloric acid. Specific administration considerations. To prevent symptoms, oral famotidine is taken 15 to 60 minutes before eating foods or drinking drinks that may cause heartburn. Pre-existing liver and kidney disease may require dosage adjustment. Famotidine is supported by evidence as safe for use in pediatric patients younger than 1 year old, as well as in geriatric patients. Patient teaching and education. Patients taking the oral suspension should be instructed to shake it vigorously for 5 to 10 seconds prior to each use. The medications may cause constipation, so fluids and high-fiber diet should be encouraged. Additionally, smoking interferes with histamine antagonists and should be discouraged. Proton pump inhibitors. A common proton pump inhibitor, or PPI, is pantoprazole. It may be prescribed in various routes, including orally, with an NG tube, or as an IV injection in the hospital setting.